I know.
You are now live on Channel 8 and YouTube.
Thank you. Thank you. All right, good evening and welcome to the Templeton Board of Health meeting. It's March 27th and it is 7:02. We are going to start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. And we do have a quorum. So we're going to review the minutes of February 27th. I had already okayed them, Laura, so it's
Yeah.
up to you to.
The only thing that I had was the same thing that you had
Okay.
noticed.
Did
Yeah.
you see something?
Oh, it
When
was
she on the
on the, when she
like-
sent us.
Oh,
The date- the time was wrong. It said it was 8 o'clock.
so I'll make a motion to accept the minutes.
All in favor? Yes, thank you. All right, so we'll move along to the communicable disease reporting. Lori.
So right now, Templeton is the report from the state from March 23rd. It's actually reporting the 5th through the 18th. We had no incidents reported. We have 0 cases in the last 2 weeks that have been reported. We're logged in as 0% positive. And from the beginning of COVID to now, we had a total of 2,334 cases reported. We have on the 29th, Wednesday, from 9 to noon, we have a vaccine clinic. It's not just for COVID, it's for pneumonia, shingles, and if anybody wants a booster for COVID, they're available too. And it's at the senior center on 16 Senior Drive in Baldwinville.
Awesome.
The listeria case that we had was actually tracked back to a food establishment in Athol. So it wasn't in Templeton. And that person is just fine.
Oh, good.
That's what I have
That's
for you
it.
on that.
That's awesome.
That's it.
All
Oh,
right.
we could talk about May 11th too.
Okay, yes.
So we've been notified that, and I'm sure people have seen it on the news, that the
State of
governor
emergency.
filed on March 15th for the public health emergency for COVID to be ended on May 11th, 2023. It required a 45-day notice for that to happen. The rates have gone down so much and the actual strain of COVID has lessened
Yeah.
so much that they don't consider it a public emergency
Mhm.
anymore. They did say that they encourage Massachusetts residents to continue taking important prevention measures to keep our communities healthy, like getting boosted, masking, and staying home when you're feeling ill. While we continue living with COVID-19, we can now incorporate the tools to manage this virus into our standing response to respiratory illnesses within our communities and healthcare system. So,
That's all a good thing. So,
yeah, happy day.
yes. What's interesting today, I wondered if at the doctor's office, they would make you wear a mask, and they did. So I'll be curious to see how they do that in hospitals and whatnot, if they still mandate it or it's optional like it has been.
I think when they're a private
Offices.
entity, they can make those decisions for
decisions, yep.
themselves. So it'll be up to them.
Yeah.
I did notice that when I went grocery shopping this week at Hannaford's and Gardner, all of the plexiglass was down, everything was, yep, just wide open. So
Yeah,
you're starting to see changes.
changes, which is nice. So, awesome. Okay. So then the community septic loan, 410 Patriots Road.
So 410 Patriots Road has a very old system, and what's happening is they have the opportunity to tie into sewer.
Okay.
And we do support that through the community septic loan program. So Actually, I'll let you guys look at that.
Okay.
The total is on there. That's with all the fees. And the sewer cost, the tie-in from a septic installer, plumbing.
Okay.
And if you want, I do have the. So it's gonna cost. $6,000 for the actual septic and sewer service to do the tie-in. And then with the plumbing, that's a total of $14,425.97. And then we have. There's a fee for the inspection at the sewer department. There's a fee for the administration of the actual loan itself, doing the paperwork and filing it.
Mhm.
And that brings the total to $20,625.97.
Okay.
I can't, there's no reason not to do it.
I was gonna say, no, I have no objection to that. So.
They are up to date on all their taxes.
Taxes.
Yep.
Okay, and all the paperwork is there and you've got it, and I say yes. All right, we both agree?
Yes.
All in favor of that?
Yes.
Well. Okay, chairman's report. I have nothing to report. Any members, do you have anything to report, Laura?
Just that, I know, as you know, I got papers this way.
Her papers are in Laura's
So,
papers for
thank you.
the
You're
election.
welcome.
Thank you.
Okay,
With the next meeting, I have to look at dates because I will be out of state the 21st through the 28th. So I will look at dates tomorrow. I think Monday, the second Monday of next month is available.
of April or May?
Of May,
May, okay, so that would be the 8th,
I believe so,
okay,
but I have to actually look.
okay. And that would,
That'd be right in the middle of,
Right.
I know other people are gonna be away, so we have to kind of balance it in between.
that would be wonderful as far as
Okay.
I'm concerned. Would that work for you, Laura?
Yes.
Okay, and Lori, just let us know.
Yeah,
obviously, you'll let-
I'll actually look at that tomorrow morning, first thing. And I wanted to also give you some things to look at and think about. I have a young lady from RCAP Solutions who would like to talk to the board about different programs that they're currently supporting for private wells.
Mhm.
And to date, I don't have anyone who has tested and had an issue yet. But proactive is better than reactive, and we've been looking at this for a little while now. And she would come in and talk to us about different loans that they're doing to help people that need help. And I'd like to put her on the agenda for the next meeting.
That sounds great.
And
She all together with this?
yes,
Okay, same, okay,
yes.
perfect.
I also spoke with Steve Castle today, and I know I've mentioned it at the last meeting about looking into rubbish hauling
Mhm.
for the town, and Steve was thinking that he would be able to do a poll through TCTV
Oh,
if we were interested in that, just to get people's feelings.
Mhm.
And I know there's strong feelings, so I like to weigh it out prior to.
Yeah.
that makes sense. If that's available, that would be great to
Yeah.
see.
And we might not get any responses, but I think it's a nice thing to actually just try and see what we get.
I agree with that. That's kind of cool.
Okay, so I'll give Steve the go ahead then. I'm sure he's actually watching,
We'd love to see that, Steve, if you're watching. So,
and I'll work with him to come up with some kind of verbiage about what we're actually thinking about, looking
yes.
for. And go from there. I'll send it to you for approval prior to it
Okay,
happening.
great.
And that's pretty much what I have for you. I'm still working with abandoned housing. I do I've been working with a contact at USDA, Jim Lavin, who's been very good. He's trying to, I don't know if you know this, but abandoned houses that USDA have stay abandoned for a really long time because the process is so slow. But he's come up with some ideas on ways to move it. Yeah. And maybe get some other people in there that qualify for the same benefits, housing. And I am really happy with that idea, and I will help him as much as I can. So I'll probably put that on our next meeting too.
Okay,
And he will probably want to do a quick presentation.
okay.
Other than that, that's kind of what I have.
Right, as always, you're busy, Lori. Thank you. Yeah, the abandoned housing, anything that would help.
10 Pleasant Street is starting
Oh, really?
demo
Demo.
shortly.
Awesome.
Yeah, it's had the rodent survey and the asbestos survey is happening. And after that, it's been through the bid process and awarded. So
Oh, that's awesome.
Awesome.
So many people will be so happy. with
yes,
that.
me,
Yeah,
will be
well,
so
you,
happy, I'm
yes,
sure.
especially because it's been there for a while.
one of them,
And also with the Drury Lane too, so.
right?
By it's, you can see a difference. Alrighty,
It's
so
starting.
it's starting, that's good. So. Right, and I guess.
I'll make a motion to adjourn the meeting at 7:14.
7:14, we're ready to adjourn. Thank you.